Welcome back, folks. We're out here at 3017 Veterans Boulevard at People's Health Medicare Center. The beauty of this place is it's really all about you. You get to come out here and figure out what's best for you. And they're going to go through all of the questions, how this works. It's all about your health care, which is a very important topic. And we're also the beneficiary of having an expert join us right now, Karl. Nick is the Vice President of Growth of Alabama, Arkansas, Georgia, Louisiana, Mississippi for United Healthcare, Medicare, and Retirement Division. People's Health is actually a United Healthcare company affiliated with an insurance company. That's important, right?
It's very important. And People's Health's been around since 1994 and has been servicing people in Louisiana since 1994. And in 2018, United Healthcare came in and acquired People's Health. And to me, it's really kind of the best of both worlds. You still have the local feel and the local plan and the people that service our members here locally, but you have the backing of a Fortune 5 company that has all the national resources and everything that give you to really make the best of both worlds.
I remember Karl Solomon was one of the founding members, I think, of People's Health, right?
That's correct. She was our CEO.
CEO for a long time. One of the brightest women I've ever met in my life, and an aggressive one, too.
I couldn't agree more. She's the lady that brought me into this industry and was a big mentor of mine.
She kind of changed the landscape here in many ways, right?
Yeah, definitely. And she made it personal. That's what she did the best out of anybody I've ever been around. Is she made every interaction with a member, an employee, it was all personal to her, and she was special.
The recognition of so many folks in the People's Health functions, whether it was a Saints game or this or that or somewhere else, kind of became the hallmark of People's Health. People's
Health was known and still known today for their interaction in the community, and through the Saints and through LSU and through the councils on aging and the food banks and all the groups that we help today. She was kind of the mother of that.
Yeah, and this is kind of emblematic, the People's Health Medicare Center, of that whole mindset, that whole mantra of how you interact here. I've had so many folks that have visited here that stop me in the grocery store. You know, they hear me talking about it, and they said, the way you described it is the way it happened.
Yeah, and that's exactly what we want it to be. We want to be a resource to the community. Medicare is extremely confusing, and folks don't, especially people turning 65 that have never had experience or interaction
That's frightening enough in the first
100%.
place.
100%. Their only experience
having just gone through it.
Their only experience with Medicare is it coming out of their payroll check, right? I mean, and then all of a sudden you've got to make decisions and do things so we're here for that. That's exactly why we're here, is to answer their questions and just give them peace of mind that they're making the best decision for them. And that's what it's about. It's not about selling people's health. It's just about educating and having people choose what's best for them. And a lot of times we feel like people's health is the best for them.
Yeah, I mean, and I've said to folks, just the other night at dinner, we were discussing it with some folks that are recently retired, and I said, look, just stop by over there. It's a really comfortable environment. They're going to help you. It's all about you. They're going to lay all of these things out there, a lot of questions. It's all very confusing. What part can I exercise? Which part can't I? And I mean, the list just goes on and on.
That's exactly right. And I hear so many times that, my neighbor told me that this was the best plan out there. And your neighbor may believe that because in your neighbor's situation, it was what's best for them, but you're not your neighbor. And what works best for you and the circumstances financially, providers. I mean, there's so many things that go into this that drive the decision, that we're here just to answer those questions. There's no pressure. Just come and let us help you and let us answer your questions.
So we're visiting with Karl from United Healthcare, People's Health, Growth. You're responsible for Alabama, Arkansas, Georgia, Louisiana, and Mississippi. Interestingly, a lot of this aligns state to state, but doesn't in many cases, right?
That's correct. Yeah, I mean, so the program is the same across states, but the plans and the offerings and the benefits, they differ parish to parish or county to county. I mean, it's not the same anywhere really. And I live here in Louisiana. I was lucky to come up through People's Health, and if you cut me, I probably bleed teal, but now I've got to bleed a little more blue. with United, and it's been a lot of fun. It's been a learning experience, but it's been a lot of fun to kind of go across state lines and learn some other areas.
Yeah. So let's talk about this, the open enrollment period. In fact, in the commercials that I do, I say that's a nuance of Medicare, and it is. It's a little different. It's not your employer-sponsored health plan. It's not a conventional health insurance plan, and they have some nuances that are important to know about. So this enrollment period started October 15th.
It started Sunday, October 15th.
And it goes through when?
December 7th is when the enrollment period. And so every year, so when you first age into Medicare or turn 65, you have what's called your initial enrollment period, where really you have a 6-month window to enroll in Medicare and then choose a plan or how you're going to have your Medicare administered to you, right? Mm-hmm. And then after that, annually, you have the ability to change October 15th to December 7th for a January 1st effective date. Now, there are reasons and things that people can change throughout the year, whether they move out of a service area and into a new one, or they have state Medicaid. There's a number of reasons that can drive that. But for most people, it's this time of year, which is why you're going to see the ads. Your mailbox is going to be full of advertising, and plans change year to year. So what's good right now and what might be best for you may be changing next year, and you've got to do that research and make that decision.
So it's kind of a re-education process, too, and why that's the beauty of this People's Health Medicare Center, because y'all are here Monday through Friday, 8 to 5, 52 weeks of the year.
That's correct. And we've got member service reps that can help our People's Health members, but we also have licensed sales representatives that can advise and educate people on the benefits of the plan.
And if you do have a change, this is the place where you want to come to get all of that resolved.
It's
easy.
when
I came here, because it was my first time, I'd reached this benchmark of 65. I was not happy about it at all, and went through it. And in less than 5 minutes, y'all explained this whole thing to me as to what I needed to do, because I'm still actively employed. I have an employer-sponsored health plan, and what that means. They told me go to this website, press this button, and I'm illiterate when it comes to this. That button, that button, that button. Bingo! I did it right first time out.
That's exactly right, and I'm willing to bet they didn't tell you to join People's Health.
No, they didn't.
Right? They advised you on what was best for you, and what made the best decision for you, and that's really
people
what this
tell
is
me
about.
that all the time. Oh, yeah, they're going to. I said, no. I said, I can tell you from experience. They told me this is what you want to do, and this is, and it wasn't the People's Health.
Yeah, you don't get the name and the brand that we have by telling people, ill-advising people on what's best for them, and that's really at our core who we are and what we do.
So we've been talking about these informational meetings, right? Tell us about why these are important.
Yeah, so we have, they call them enrollment seminars or informational meetings that it's more of a classroom kind of group setting where we have a licensed representative that goes through the benefits of the 2024 plans that we offer and all the different products that we're going to offer in 2024, and just lays it out there and tells, what the copay is going to be, what the Part B give back may be on certain plans, and different benefits that change year to year and what we're going to offer in 2024. And we've got them across really the entire state, but we also offer them here. We have one here at 1 o'clock today.
Yeah, at 1 o'clock for sure. And I see a bunch of people walking in to take advantage of that. So this is a good entree and a great point to pivot to talk about the difference between original Medicare and Medicare Advantage. And this is where it begins to get confusing.
This is where it gets fun, right?
Yeah.
And yeah, exactly. So original Medicare or Medicare Part A and Part B, right? That's when you hear the term original Medicare, that's what they're talking about. And that's administered by the federal government. There is, when you have your red, white, and blue Medicare card, that's what you have. And it shows your Part A and your Part B effective date. And you show any provider that accepts Medicare, you can show that card, and you pay deductibles and co-insurance, and that's it. It's administered by the government. You pay your deductibles, your co-insurance, and that's what you have. Medicare Advantage are private insurance companies that contract with CMS and the federal government to administer people's Medicare Advantage for them, or their Medicare for them. And they vary, the plan types, the benefits of those plans vary, but they cover everything that Medicare covers, plus additional things like dental, vision, fitness center memberships, over-the-counter benefits. There's a number of things that are added into those plans, and they're generally in an HMO or a PPO plan, meaning an HMO you have to stay within the network, or a PPO you have in-network benefits, where if you go into a contractor provider, that's who you get to see, but you also have the option to go outside of the network as well.
And as a result of that, that's why these other benefits and kind of lifestyle benefits come into play. So the other day I was at the Y, and People's Health was there.
Yep.
And I was shocked how many people are on fitness programs as a result of their Medicare Advantage plan, because they got a fitness center membership included.
That's exactly right. And no cost.
And I mean, these folks look great. I mean, they were, working out, doing this, doing that, major lifestyle change. They were retired, missing a lot of their old friends, and they got an opportunity to create a whole set of new relationships, not to mention the relationship with the YMCA.
Yeah, and I mean, that's our job, is to keep people healthy and happy. And what better way to keep people's health up is by exercise and fitness, and also the social part that comes with that as well, right? You go into the Y in the morning, or you go to the Auctioner Fitness Center, or the 24-hour fitness. We've got a number of them. We've got over 100 of them really in the greater New Orleans area that you can choose from. And you go into those and you see people drinking a cup of coffee and just socializing, but then also you see a number on the treadmill running and doing whatever works best for them. So it's a big benefit, and one that we're really proud to offer.
All right, we're going to take a break here. We'll come back to this because there's some more to talk about, mainly Part D prescription drug coverage. You also get another area where it kind of gets a little bit confusing too, right?
That's right.
All right, we'll be right back. We're visiting with Nick Karl, Vice President of Growth of Alabama, Arkansas, Georgia, Louisiana, Mississippi for United Healthcare, Medicare, and Retirement Division. Stay with us, folks. Welcome back, folks. We're here at the People's Health Medicare Center at 3017 Veterans Boulevard, right next to Party City. A lot of parking, easy in, easy out. Folks are lining up here, getting ready for the 1 o'clock informational meeting. They're taking advantage of it, and you should too. We're visiting with Nick Karl, Vice President of Growth in the United Healthcare, Medicare, and Retirement Division, and People's Health is a part of the United Healthcare Company. And we've been talking about the differences between traditional or original Medicare and Medicare Advantage. And I guess, one of the other things about that is Part D, prescription coverage. Tell us about it.
Yeah, so if you just went the original Medicare route, you would have to enroll. You don't have to, but you would choose to enroll in a prescription drug plan, which is a standalone plan with a insurance company to administer your pharmacy drugs, right? Mm-hmm. Where a Medicare Advantage, most of our Medicare Advantage plans include Part D in it. So it's an all-in-one plan that covers your A, B, and D wrapped into one plan. So, where you pay your co-pays and your coverage at the pharmacy.
And that part of Medicare is probably, is it safe to say, most closely aligned to what conventional health insurance or employer-sponsored plans are?
Yeah, I would say that. I mean, there's probably some lower cost on the Medicare side than what you would see on some group plans, but you have a drug formulary, and drugs are covered or they're not covered, and you're going to pay your copay and different tiers and different levels within that.
So when we look at Medicare Advantage as opposed to original Medicare, is it more expensive?
Actually, it's not. Original Medicare, again, you don't get those ancillary benefits. You don't get the extra things that you would pay for if you needed under original Medicare. So things like the dental, vision, hearing, the fitness, those things don't come with original Medicare. All that's covered under original Medicare is your Part A covers your inpatient hospital stays, and then your Part B covers your physician visits, right? And that's really what's covered under original Medicare. And then you would have to enroll in a Part D plan to have prescription drug coverage, and you could pay a premium for that, and the coverage may not be as good as what you can get on a Medicare Advantage plan that includes that prescription drug coverage.
Now, amongst the Medicare Advantage plans, there are pricing differentials, right?
Definitely. And we have a number of plans under the People's Health name that have different benefits and that are different types of plans. So it's not all the same. It's not just have one people's health. We have a full portfolio of products that can meet the needs of people as they age through Medicare or as their health changes, and it varies.
So I know I've seen y'all's plans, and there's an offering of no annual deductible, zero premium. What does that mean?
So a deductible is when you pay what you pay before the plan pays anything.
That's your out-of-pocket expense before
the plan covers anything. And our plans don't have a deductible. So we pay the first day you're on the plan. That's correct. The first day you're on it. And then you generally are going to have co-pays for it. So say for one of our plans, the Choice of 65 plan here in Orleans and Jefferson, there's a $0 copay for your primary care physician, and then it's a $20 copay for a specialist. So you pay that, and then we pay the rest.
Right. And so when you're making comparisons, you want to look at the full plethora of what the offerings are. And there's a lot of them, and they can be confusing. And I've said this before, if you're not familiar with the language, the lingo, the nomenclature, it even gets more confusing.
That's exactly right. And there are some plans that have premiums, meaning that you pay a monthly amount to be on the plan. Our plans are zero premium, and on top of that, we pay a Part B give back, which means we're going to pay a portion of the members' Part B premium on their behalf. So not only is it zero premium, it's more dollars back in their pocket. And we're introducing a new plan this year with an $86 a month Part B rebate. So $1,032 a year that we're going to pay back into the members, going to get more in their Social Security check for that plan.
So what other costs would you typically see with a Medicare Advantage plan?
So the copays are going to be for your lab test, your inpatient hospital stays, therapy, physical therapy, rehab, those types of things. There are going to be copays associated with that. Emergency care, ambulance, those types of things. You'd see copays associated with that, which are generally going to be lower than what you would have on original Medicare.
Which is what you would see in a traditional, conventional health plan anyway, right?
That's exactly right. Really, the Medicare Advantage plans are going to be closer to what somebody had on a traditional group plan than what original Medicare is. And again, original Medicare, it's generally you pay the deductible, and then it goes to like an 80-20 coinsurance, meaning that CMS or Medicare would pay 80%, and then the member's responsible for 20% of their costs. And there's no out-of-pocket max.
And that would ceiling out. There is no out-of-pocket.
There is no out-of-pocket.
So that's it keeps going.
Correct. Where on our plans, there is a maximum out-of-pocket per year. So on one of our plans, that maximum out-of-pocket is $3,600, and that's not a deductible. That just means that the most that someone could pay in a calendar year is $3,600.
So if your health went awry and you just needed a plethora of medical services, you know that there's a certain sum that is the most that you have to pay. But with Medicare, traditional Medicare, there is no ceiling.
There is no ceiling. That's exactly right.
The only ceiling is the year.
Is the calendar year.
Right.
That's correct.
That's a big difference.
It's a huge difference, and one that, again, the more that people are educated and understand and take a look at that, they realize, wait, I can budget for this. I can understand what this is going to cost me, and it's a big reason people choose to join these plans.
So if you opt for a Medicare Advantage plan, does that mean you're out of traditional Medicare or no?
Well, you're still enrolled in the Medicare program, and you can go back during the annual enrollment period. You can choose to disenroll from the Medicare Advantage. Generally, it's a year-to-year kind of contract, right? Yeah. And they can, if you join and you don't like it, you can go back that next enrollment season. But it's a great option for people. It's something that people just need to do their homework and take a look at. And it's not perfect for everybody. I'm not here to pretend like it's perfect. But it's a great option for people to take a look at and make a decision.
No matter what plan you're looking at, there are limitations, right? And it's just how does that align with you financially, your health care maintenance, right?
That's exactly right.
Your existing health, right?
And that changes every day, right? So, yeah. What works best for you this year, next year may not. And that's why it's so important for people to take a look and get a feel for what they're being offered.
So when you're looking at this, what are like the top 3-4 things that you should be looking at, to kind of drive this decision or to narrow it down?
Yeah, so the number one thing that we hear is cost, right? People are on fixed incomes, especially as they retire. The dollars aren't flowing in like they used to, and so cost is the number one thing. Then it probably goes to the network of doctors and making sure that the doctor that you choose or the hospital that you want to choose is in the network of the plan. And People's Health has done a really good job over the last few years of keeping the providers that we've had, but also adding new providers to the plan. So if you maybe looked a few years ago and your doctor wasn't in it, I would encourage folks to take a look again, because it's likely that they've been added to the network. And then after network, it goes to that prescription drug formulary and taking a look at the coverage of the drugs that members are on it. That's probably the number one decider, to be honest with you, because that's something, it's like paying a premium. You know that you're going to be taking these maintenance medications, and you know that they're not going away, right? So take a look at what that's going to cost you.
Do the formularies change during the year?
They don't change during the year, but they do change annually. So that's, again,
so during that enrollment period, y'all have established what the 2024 formulary is going to look like for your plans.
That's exactly right. So we've got all of our plan benefits out there. They're on our website.
That's a little different than conventional, like your employer-sponsored plans, because they can change it on a whim.
Yeah, that's correct. We're not allowed to we can change it for the better. We can't change it for the worse. So we can make.
Well, that's a protection that you don't have.
That's exactly right.
In an employer-sponsored plan.
So we can bring the cost down in the year if we feel the need or need to, but we can't raise it on somebody on the Part D side.
Interesting. And then these extra benefits. A lot of times, I know that I've chosen, because of where I am in life, I don't have a single cavity. So, I kind of wonder, why would I want dental? I don't, if I don't have a cavity at 65, I mean, I'm doing something right. I don't know what I'm eating.
No, you're doing a lot right. But it also covers preventative dental, right?
Yeah.
So it covers your cleanings and your x-rays and those things that you need to do to make sure that you keep your teeth healthy. So it's not only the comprehensive side and the dentures and fillings and extractions, but it's also just your traditional cleanings. I mean, a traditional cleaning now can cost people, a couple $100, and that's covered on the plan at no cost to the members.
Yeah, y'all have pet insurance?
We don't. Unfortunately, we don't. But you never know.
Yeah, but these are extra benefits that in traditional Medicare they're not offered.
That's exactly right. Traditional Medicare does not cover dental. It does not cover vision. It doesn't cover hearing aids, and those are additional benefits that we offer to our members.
So again, back to this open enrollment period that started on the 15th and ends on the 7th. This is the time that you have to exercise whatever option you want. It pretty much has to happen now. There are a few exceptions, but for the most part, it's got to happen during that period of time.
That's correct. October 1st, we can announce our next year's benefits and start advertising them. And we have to send our members what's called an annual notice of change, or send them a booklet showing them anything that's going to change from their current year to their next year, so that they're informed and know what changes are coming. And then they can then go out and shop and take a look and make sure that their plan they're in right now is best for them, or they can shop and choose a new plan.
So if they're happy, you send a statement, they're happy, they're willing to accept whatever the changes may be, do they have to do anything?
They don't have to do a thing. They would stay enrolled in the plan. And then they would get a new ID card and be enrolled for the next year. If they want to change, they have to make a change
during this enrollment
period.
But if they're okay with whatever the upgrades or downgrades, if there's any, and things are always changing because the federal government's always changing these.
That's exactly. The rules are constantly changing. The amounts that plans are being refunded are changing. So there's a lot of, and this year especially, CMS has made some changes to the program and how they're funding it. And so there are some plans that are making some bigger changes, and there's other plans that aren't. And People's Health has done a really good job of maintaining stability in their plans, offering the best benefits that we can to our members and keeping them happy. And we have over 100,000 members now across the state of Louisiana. We're really proud of that. We just passed that benchmark in July. And we've done a good job, and we're going to continue to do that.
So when Center for Medicare Services makes a change, sometimes it's positive, sometimes it's negative?
That's correct. I mean, we are funded on a per member per month fee, right? And it's based on your star rating. It's based on a number of measures. It's based on the parish that member lives in. There's a number of parameters that go into that. And this year they made a change to the funding model and actually reduced it a little bit. And they're going to do that over the next 3 years just to make the program more sustainable. And we've been able to continue to offer really rich benefits, and that we'll be able to do that for years to come.
We'll talk about this star rating and some other issues. We've got to get to another break. We're visiting with Karl, Vice President of Growth for United Healthcare Medicare and Retirement Division. We will be right back. 504-260-1870 on the Oakland Art Jewelers Talk and Text line. We're broadcasting live from the People's Health Medicare Center at 3017 Veterans Boulevard. They will be starting their next informational meeting at 1 p.m. You can grab a sandwich here. You can grab some incredible-looking donuts here, coffee, all kinds of soft drinks. Come on by, say hello, and we will be right back. Stay with us. Welcome back, folks. We're visiting with Karl, Vice President of Growth for United Healthcare Medicare and Retirement Division. People's Health is a part of United Healthcare. Chuck out in Gonzales, Nick, called about a Medicare supplement plan, and if People's Health offers one.
Yeah, so People's Health doesn't offer a Medicare supplement. All we do is offer Medicare Advantage plans. But to answer kind of what a Medicare supplement is and how it works, so as I was mentioning on original Medicare, you're responsible for deductibles and co-insurance and some costs that can raise. A Medicare supplement pays that. So they're really kind of the secondary payer. You pay a premium to be on that plan. Medicare pays primary, and then that supplement plan would pay your costs for those. And there's different levels and different coverages, plan A, plan B, and they go all the way up. But there's different levels within that.
So that's something that would be offered by United Healthcare.
United Healthcare does offer Medicare supplement plans. Okay. That's correct.
All right. Let's talk about this 5-star plan. I mean, that's a big deal in the Medicare Advantage world, right?
It's a really big deal and something that we're really proud of. And we've been 5-star for the last 2 years. And we just found out last Friday it was announced that we are 5-star again in 2024.
So 3 years in a running. Has anyone else achieved that?
There's been others across the country.
But in Louisiana?
In Louisiana, no. We're the only 5-star plan in the state in 2024, and something that we're really, really proud of. And just to give you kind of a context, there's 545 contracts across the country, and there's only 31 5-star plans. So about 6% of plans earn that ranking, and we're proud to be the only one in the state to get that.
So what does that mean when we start talking about the plan types and the offers that y'all are able to make in 2024? That helps you, right?
It does, because the reimbursement is higher from CMS. On the higher your star rating, you get bonus payments for that, and we're in turn able to offer richer benefits to our members. So it's a big deal, and it's based on the quality of what we offer to our members, and it's based on some claims data and data that we report, but also it's based on surveys from our members, and they ask our members to rate us, and we're super proud to be rated 5 out of 5 stars.
So who's actually eligible for the People's Health plans?
So really anybody, generally Medicare, you're eligible at age 65 or older. But you can also be eligible for Medicare based on disability. So it's not just based on age. If you're disabled for 24 months and you can become eligible for Medicare that way. But to enroll in a Medicare Advantage plan, you have to have Medicare Part A and Part B, and you have to live in the defined service area of that plan. So, we've got plans that we offer across the state, and we've got some plans that are statewide. We've got PPO products that we offer in all 64 parishes across the state, but then we also have HMO products that are based, we've got one for Orleans, Jefferson, East Baton Rouge. We've got a different one down kind of in the river parishes, and right. So it varies on where that member lives.
Now, you guys have a new plan this year that y'all are offering, right?
We do. We're actually introducing a new Medicare Advantage plan in the greater New Orleans and Jefferson Parish area with a higher monthly rebate, so an $86 a month rebate. And it's really designed for people that are aging in, that are healthy, that don't feel like they really need to use the benefits a ton, and they want more money back in their pocket. So we're going to give them $86 a month. It still includes a lot of those extra benefits, like an over-the-counter benefit, eye exams. It gives them, some dental coverage, but those things aren't as robust as some of the other plans that we offer, but it gives them that money back.
So when you say over the counter, that could be a big thing too, because we're involved in flus. I've had a sinus attack that I'm going on week 7. So,
Yes.
I can't seem to shake it for whatever reason, but and it covers all of the stuff that you utilize for that.
It
right?
does. So depending on the plan that the member enrolls in, they either have a monthly allowance or a quarterly allowance that they can use at local pharmacies to go in and get things like pain relief, allergies, cold and flu, first aid, toothbrushes. There's a number of, over-the-counter approved items that the member can go in and use their People's Health card, and we pay for it.
Now, there's also that People's Health card. You get credit, on it. I think y'all call it the U card. Is that what it's called?
That's correct. So we're introducing that in 2024. United rolled out the U card across the country last year, and it's an all-in-one card. So the member is going to get it's going to be their ID card that they're going to show at the doctor, at the hospital, the pharmacy, wherever they're using their benefits. But also on the backside of it, there's going to be a barcode that they'll be able to use at the store to purchase their over-the-counter items that they're eligible for as well. So it's kind of all-in-one.
Now, People's Health has a personal emergency response system. Is that new this year too?
We've had it on a couple of plans, but now it's on all of our plans, and we're proud to offer that. So at no fee to the member, they'll be able to get that personal emergency response button that they can wear, and if they fall, they can push the button, and it'll alert the authorities and have somebody come and help them.
I'm going to need one of those. Final thoughts?
No, I just would encourage people to come out and take a look at what we have to offer. peopleshealth.com is probably the best place to go and learn more about the benefits that we're going to offer. But thank you for being here.
Thank you for having us. We really appreciate it. Nick Karl, Vice President of Growth of Alabama, Arkansas, Georgia, Louisiana, Mississippi for United Healthcare, Medicare, and Retirement Division. People's Health is a part of the United Healthcare companies. We will be right back. Scoot's up next. We'll visit with him in just a second. Stay with us. We are back, and Scoot's up next. What do we have coming up, Scoot?
Well, since we're at People's Health Medicare Center, we're kind of focusing on boomers. So I thought we'd talk a lot about the baby boomer generation and what they have and have not contributed to society.
So baby boomers fall in what years?
1946 to 1964.
So I'm in that baby boomer year. You're in that baby boomer
Oh,
year.
I'm there.
He's not. He's too old.
She's not. She's too young.
So we could just sit here and identify who's in that baby boom.
Yeah, we used to be the largest segment of the population, and now we're not. Millennials are. And it's going to be interesting for Zoomers and Millennials and Xers to listen as well, because, you might get some insight into the baby boomers and who they used to be and who they are today.
Absolutely. Scoot's up next, folks. Hope you enjoyed today's show. We'll see you guys again in the morning. Have a great Tuesday evening.